Hello, my name is Samantha, and I'm going to be talking to you tonight about complex regional pain syndrome. What is it? So, complex regional pain syndrome is pain, vascular, and atrophy related condition. Complex regional pain syndrome is a secondary to trauma, so surgery, fractures, crush injuries, or sprains. It is a chronic inflammatory disease that can affect any part of the body. However, it typically affects one, so an arm, leg, hand, or foot. It is involved in multiple areas of the nervous system, such as the autonomic, somatosensory, and motor systems. People with this diagnosis typically complain about allodynia, which is pain to stimulus that does not usually cause pain, hyperalgesia, which is a sensitivity to pain, and lastly, sudden pain. Psychological and physical stimuli, such as sensitivity to cold, pressure, and touch, usually exacerbates the pain. The typical symptoms in the acute phase, which is also known as warm phase, include inflammation, redness, elevated skin temperature, and edema are present. After 3 to 6 months, the condition will go into a cold phase as the inflammation begins to go down. During the warm phase, people do not move the affected limb because of pain, which can cause fibrosis that limit movement during the cold stage. The skin becomes cold and exhibits atrophy, autonomic deficits, which these deficits include hypohidrosis, which is sweating less, and hyperhidrosis, which is sweating more, start to appear. Osteoporosis, arthritic changes, and severe muscle atrophy arise when this condition reaches its advanced stages, depending on whether a conclusive nerve injury is present or not. Complex regional pain syndrome can be classified into two classes. People who have CRPS1, which is formerly known as reflex sympathetic dystrophy syndrome, and are defined as those who do not have a verified nerve injury. When a correlated verified nerve injury occurs, CRPS2, which was formerly called causalgia, results. So, type 1 is going to not have a verified nerve injury, and type 2 is going to have a verified nerve injury, or something like that will occur. When the complex regional pain syndrome occurs, the pain matrix becomes hypersensitive, altering the structure and function of the brain. So changes in the CRPS imaging are shown in the thalamus, somosensory cortex, cingulate cortex, hippocampus, and amygdala. These changes are consistent with changes in sensation of pain, emotion, cognition, and memory. Now I'm going to go over the systems. So first would be sensory. So that's going to usually, it will be with this condition, severe spontaneous pain, often intensified by skin contact, heat, or cold. The anatomic is going to be abnormal sweating, vasodilation, or vasoconstriction in the skin due to blood flow change and disuse of muscle, joints, and skin. Motor would be muscle atrophy, paresis, and restricted range of motion secondary to kinesiophobia. Affects one side, so unilateral limb. It's going to be either the arm, the hand, the foot, or the leg. 0.02% of adults have this condition in the United States, and then women are 3 times more likely to be affected than men, and it can also occur in children as well. The prognosis, so overall, early intervention has the best outcome, but studies have shown that the younger population, children, teens, early adults, tend to have better outcomes than the elder. Elders do have good outcomes, but just the younger population tends to have a better outcome. And then occupational therapists. So the occupational therapists have an impact on functional limitations and activity levels by providing interventions. Some of these interventions can look like splinting, tactile stimulation, and functional activities. Some assessment tools that can be used to assess where a patient client is at would be your occupational profile, the McGill Pain Scale, the goniometer manual muscle testing, circumferential measurement or a volume meter, and the Weinstein monofilament test. And then how is this going to affect one's performance or skills, patterns, occupations. So, as a direct result of trauma to afflicted areas, complex regional pain syndrome is a disorder that's known to produce excruciating pain. In order to lessen the pain, the patient or client usually refrains from moving the affected extremity, which can then result in stiffness by reducing the flexibility of the tendons and ligaments. And then fibrosis can also be caused. Muscle atrophy and weakness can also be correlated with the decreased range of motion. You also have other impacts such as like muscle tremors. The client's capacity to function and willingness to engage in activities previous to the injury may be limited by the discomfort. Their capacity to perform daily activities or occupations may also be impacted if they avoid using the affected limb or just because of the pain, the swelling, the edema, everything that comes along with the symptoms. So, depending on which limb is impacted, several occupational categories can be impacted. I'm going to talk about 3 ADLs that are going to be or could be impacted. So, the first one would be dressing. Now, why would dressing be impacted? So, due to the decreased range of motion, it can be difficult for one to say if they need to reach with their arm to get a shirt, shoes, pants, even if their leg or foot or hand. If they have no range of motion, they might need assistance or they might require some type of adaptive equipment to don or doff clothing. The next ADL is going to be bathing. So, some signs and symptoms of the complex regional pain syndrome is muscle tremors, weakness, edema, and this can all maybe cause a safety concern for, say, showering. So one is standing and they have, say, muscle weakness and they have edema and there's muscle tremors. They could also become fatigued quickly, and due to that, it could just be they would require assistance to complete this task, and it could also be a safety concern. So without like the proper setup or an OT coming in and modifying the environment, so adding a shower bench, handrail, stuff like that. Then the next ADL would be feeding. So muscle tremors can cause poor manipulation of the feeding utensils and then the ability for one to bring food to the mouth without spillage. So if you have weakness, stiffness, and then or tremors, one is trying to scoop using a spoon, bring it to mouth. Your tremor could cause you to the food to fall or not be able to independently feed oneself using a utensil requiring assistance or adaptive equipment. That is pretty much all for some examples for occupational performance and also like what one may experience difficulties with certain occupations and ADLs. So thank you for listening, and that was a summary of complex regional pain syndrome.